Hello everyone and welcome to another episode of Ask Dr. Bob. Some phenomenal questions, some we never had before, so let's get right into it. Dr. Bob, I have swollen legs every day. And she also mentioned that she has a kind of like polyrheumatica, which is like fibromyalgia. What I have learned about anytime you have legs that are swollen, there's like 3 or 4 items to think about. Make sure you're eating enough protein. Make sure you're consuming enough minerals. We use Celtic sea salt. You may in fact have some heart distress and or some kidney compromise. You really want to pursue that, but I would increase protein, increase your minerals. I think that you would notice some improvement. And bounce on a ball or on a mini trampoline for your lymphatic system. Dr. Bob, I have 2 children, 2 boys, ages 2 and 4. I want to get pregnant again. I have a hormone called prolactin that's elevated, and she basically wanted to know what to do. This is what I've learned. Anytime that a female has 2 children or more, it is really time to start working on the liver. The liver helps clear extra hormones in your body. Probably the single most common challenge for anyone that's had 2 or more children is a compromised liver, resulting oftentimes in liver gallbladder distress. So Dr. Bob's ABCs, of course, a half a red apple every day, beet fiber, carrots are really important, and then get on a detoxifying type of program. You can contact our office, go on a product called Livatrid or milk thistle. Would be very, very helpful. Dr. Bob, I have chronic ringing in the ears. This is what we've learned with ringing ears. I had someone the other day that just told me, even after the care at our office, their ringing in the ears went away. But it's usually, there's 2 items I think about. Subpar thyroid function, and oftentimes a mineral need. Lack of minerals can result in ringing in the ears. And of course, you could have a food sensitivity that could cause ear ringing. Have your thyroid checked, TSH, T3, and T4. Dr. Bob, oil pulling. What do you know about oil pulling? And that's the new buzz that's going on right now. I had someone come to me the other day and he said he's been oil pulling, and I looked at him with, like, my eyes must have been like the deer in the headlight. Like, what is oil pulling? And they put coconut oil in the mouth. And basically what's going on is the whole concept of this is coconut oil is getting rid of unwanted, unnecessary bacteria in your mouth, which promotes healing. And I had my dental hygienist years ago said, Dr. Bob, you know they're seeing more and more issues with people with chronic bacteria in their mouth affecting their body. Well, I want you to know that I use a product called Agricept L. I take 10 drops every day. I use it in 4 to 6 ounces of water. I've been using it for years, actually since 1996. We have hundreds of our practice members that take it. It's very cost effective. It's very safe. I would just definitely check it out, Agricept L. If you do decide to purchase that, 5 drops in about 4 to 6 ounces of water for 2 weeks, and then 10 drops every day. Dr. Bob, what about muscle testing? This individual also uses a similar type of biocommunication that we do, which is a Zyto testing. Muscle testing, now listen, I'm going to word this to you. Muscle testing is as objective as the person or the technologist or the practitioner that is doing it. I'm going to say that in a very logical way. I know that sometimes certain individuals may actually find what they are looking for with a muscle testing. So I think the Zyto or the biocommunication testing is probably a little bit more concretely objective. This person has had issues with their hypothalamus, they said, going off the chart. Anytime I see a hypothalamus going off the chart, that's definitely telling me your brain is tired. And there could be some other areas which we could talk about for hours, but you may be acid pH will put a compromise to your brain. Dr. Bob, I have pain all night, wakes me up all the time. We have commonly found you want to pursue to make sure you don't have cancer, because cancer is very common at night, but I also see a lot of times mineral lack will result in pain, especially leg pain, lack of calcium. Last question, Dr. Bob, I'm trying to detox and I hate eating beets. Any suggestions? I had someone do this a long time ago. Cook your beets with onions and sprinkle some cinnamon on it. Think about it as red apple pie. I'm Dr. Bob DiMaria, the Drugless Doctor.